Have you ever found yourself totally puzzled about what's actually happening down there? Whether you have a vulva yourself or you're with someone who does, believe me, you're far from alone. Hello everyone, I'm Dr. Hana Kim, a men's sexual health expert, and today we're going to take an educational yet lighthearted look at female anatomy. And yes, we'll finally dive into that much-talked-about mystery everyone keeps whispering about, the G-spot. Stick with me until the end, because we're going to bust a lot of myths, share some real science, and hopefully leave you thinking, oh, that actually makes sense now. And if you enjoy learning how our bodies truly function, not just what random internet posts claim, don't forget to subscribe and share this with your equally curious friends. All right, let's dive in. Sex 0.5. How our genitals develop. Before jumping straight into the details, let's rewind all the way back to the very start. Literally, before any of us were born. When a baby first begins developing in the uterus, there's actually no visible difference between male and female genitalia during the first few weeks. Yep. Early on, we all look pretty much identical down there, a kind of template version. Inside that tiny developing body, there are two key structures, the genital tubercle and the urogenital sinus. Around week 10, things begin to shift based on genetics. If the baby's genes are XX, the body begins forming what we recognize as female anatomy. If it's XY, it starts developing male anatomy. Here's where it gets fascinating. Both versions start from the exact same tissues. That means many structures are homologous and basically, they share the same origin but take on slightly different shapes later on. For example, the head of the penis and the clitoris both develop from the same initial structure. The foreskin in men and the clitoral hood in women. Also biological cousins. Even the scrotum and the outer lips, the labia majora, originate from similar tissue. It's essentially nature's copy and paste system, just with different finishing touches. Metasex 0.5, a closer. Look at the clitoris. Now let's talk about the real star of the show, the clitoris. The term clitoris actually comes from a Greek word meaning key, which honestly couldn't be more appropriate. It's often the key to pleasure, to anatomical understanding, and to healthy intimacy. Most people think the clitoris is just that tiny visible part at the top of the vulva, but that's only the surface. In reality, it's a much larger internal organ made of erectile tissue, similar to the penis. Think of it this way. If you could see the entire structure, you'd find it extends inward and branches out in a shape resembling a wishbone. It wraps around both the urethra and the vaginal canal, meaning it's a complex internal network, not just a small external button. Here's a fascinating fact. The clitoris has over 8,000 nerve endings. That's twice the number found in the average male organ, which explains its incredible sensitivity. No surprise it plays such a central role in female pleasure. Like the penis, the clitoris also becomes engorged with blood during arousal, leading to swelling and heightened sensitivity, the very same physiological process, though not always visible externally. Occasionally, the clitoral hood, that small piece of skin covering it, can stick slightly due to natural adhesions, causing mild discomfort, but that's completely treatable. In short, the clitoris isn't just a tiny dot. It's a vast network, an internal sensory organ designed for stimulation and blood flow. Nature really went all in on this one. Metasex 0.5, moving lower. The vagina. Next, let's move a little further down and talk about the vagina, a structure that's often misunderstood. The vagina is an extraordinary piece of biological design. It's elastic, muscular, and capable of expanding and contracting in truly remarkable ways. During childbirth, it can stretch enough to allow an entire baby to pass through, and afterward, it's capable of returning close to its original size. That's truly fascinating. Even during arousal, the vagina goes through remarkable changes. It lengthens by roughly 3 inches and widens to enhance comfort and movement. It's basically self-adjusting. Nature really did think of everything. When you look at the full structure from top to bottom, here's what you'll see. At the very top sits the clitoris and its protective hood. Just beneath that is the urethral opening, where urine exits the body. Below that lies the vaginal canal, a flexible muscular passageway. And finally, at the bottom, you'll find the anus. So altogether, women have 3 separate openings, each serving a distinct function. If you've ever felt unsure looking at anatomy diagrams, don't worry. You're definitely not the only one. Even medical students double-check sometimes. Menopause. What exactly is the G-spot? Ah yes, the mysterious G-spot. The source of endless curiosity, fascination, and probably millions of Google searches. Let's finally clear this up once and for all. The G-spot is named after Dr. Ernst Grafenberg, the physician who first described it back in the 1940s. It's said to be located on the front, anterior wall of the vagina, about 1 to 2 inches inside. Many describe it as a slightly textured or spongy area that can feel more sensitive than the surrounding tissue. Now, here's where science comes in. This particular area sits right above the urethra and near a group of glands known as the Skene's glands. These glands are homologous to the prostate in men, meaning they form from the same embryonic tissue, and they may even play a role in fluid release during arousal. Some women find stimulation of this area deeply pleasurable, while others notice very little difference, and both are completely normal. It's not a magic button that guarantees instant pleasure. Think of it instead as a sensitive zone that can enhance enjoyment when paired with comfort, relaxation, and open communication. So, is the G-spot the holy grail? Not exactly. For some, it's an exciting discovery. For others, just another fascinating part of the anatomy. What's truly important to understand is that most women experience pleasure primarily through clitoral stimulation. Because, as we discussed earlier, the clitoris has the highest concentration of nerve endings. In short, pleasure isn't one size fits all. It's personal and unique. And learning about anatomy helps make every experience healthier, more comfortable, and far more enjoyable for everyone involved. Sex 0.5, why it all matters? Now, you might be wondering, why does any of this matter if it's just biology? Well, understanding anatomy isn't merely about knowing where things are located. It's about understanding how they function and how to care for them properly. Recognizing what's normal versus what's not can help detect infections or other health concerns early. Knowing how the body naturally responds can reduce anxiety and uncertainty during intimacy. And perhaps most importantly, it builds respect. Because once you understand how intricate the human body truly is, you begin to treat it with far greater care. Knowledge is power, and in this case, it's also comfort, confidence, and connection. Sex 0.5. Let's wrap it up. To sum everything up, we all start out the same way in the womb, nature's default template. The clitoris and penis are essentially long-lost biological twins. The vagina? It's the Swiss Army knife of the human body, flexible, resilient, and perfectly built for adaptation. And the G-spot? It's real, yes, but not quite as magical as the internet often makes it sound. Or, as I like to say, the human body is the most complicated instruction manual you'll never fully read. But today, at least, you've explored one very important chapter. Sex 0.5. Final thoughts. Thank you so much for watching. I hope you learned something new today, and maybe even smiled a few times, too. In my next video on female sexual health, we'll be exploring a topic that sparks even more curiosity: female fluid release, and what science actually reveals about it. So don't forget to subscribe and hit that notification bell so you won't miss it. And as always, take good care of yourself, because you are absolutely worth it. I'm Dr. Hana Kim, and I'll see you in the next one.